Think about the students that you work with. You're with them because they have difficulty with interpersonal relationships. Most of them have their academic needs met, but it is the other parts of school that are challenging for them. That is what you work on with them. These statistics bring home the importance of what you do every day. Mental health impacts every part of your life, and it doesn't just affect you. The old saying that, if mama ain't happy, ain't nobody happy, applies to more than just mama. Anyone with mental health issues affects everyone around them. We are used to thinking of drug use as a lifestyle choice, but if we apply this definition, we see substance abuse through a different lens. Children have to rely on the adults in their lives to get help for them. They are unable to seek it out on their own. The adults must first be able to recognize when there is a problem and then find help. As an aside, the eligibility area for ED services is one that draws down more federal dollars than SLD and some of the other disability areas, which make it more costly. These children may need additional supports, and you are one of those supports. When I first started teaching, it was believed that young children, couldn't experience depression. It is a myth that children don't experience mental health problems. We've learned since then that the fact is, every young, even very young children may show early warning signs of mental health concerns. These mental health problems are often clinically diagnosable and can be a product of the interaction of biological, psychological, and social factors. Half of all mental health disorders show first signs before a person turns 14 years old, and 3/4 of mental health disorders begin before age 24. Unfortunately, less than 20% of children and adolescents with diagnosable mental health problems receive the treatment that they need. Early mental health support can help a child before problems interfere with other developmental needs. However, studies show us that people with mental health problems get better and many recover completely. Recovery refers to the process in which people are able to live, work, learn, and participate fully in their communities. There are more treatments, services, and community support systems than ever before, and they work. You can be an important influence to help someone get the treatment and services they need by reaching out and letting them know that you are available to help. Working with your program support teacher to help them access mental health services. Learning and sharing the facts about mental health, especially if you hear something that isn't true. Treating them with respect, just as you would anyone else. And by refusing to define them by their diagnosis or using labels such as crazy. Promoting the social-emotional well-being of children and youth leads to higher overall productivity, better educational outcomes, lower crime rates, stronger economies, lower health care costs, improved quality of life, increased lifespan, and improved family life. Positive mental health allows people to realize their full potential, cope with the stresses of life, work productively, make meaningful contributions to their communities. Ways to maintain positive mental health include getting professional help if you need it, connecting with others, staying positive, getting physically active, helping others, getting enough sleep, and developing coping skills. Many factors contribute to mental health problems, including biological factors such as genes, physical illness, injury, or brain chemistry. Life experiences such as trauma or a history of abuse and family history of mental health problems. Also, people with mental health problems can get better, and many recover completely. Family history is an important part of the diagnostic process, as many types of mental illnesses seem to have a genetic basis. Even information about who had substance abuse problems in a family may indicate someone who was undiagnosed but was self-medicating. The central nervous system can be affected by a traumatic head injury, which, if you have seen Concussion with Will Smith recently, you realize how the brain is affected by head blows. But extremely high fevers or certain illnesses can also affect the central nervous system. Early childhood experiences help build success later in life as children begin developing social and emotional skills at a very young age, and these skills form an important foundation for being able to succeed in school, in relationships, and in life. For those children who are exposed to trauma early in life, trauma-informed treatment can be very helpful. It is a new push in the mental health community. Trauma-informed care is coming out of research which is influencing current practice. You will likely be hearing more and more about trauma-informed care in the future. The negative impacts of these early experiences, sometimes referred to as toxic stress, can be prevented or reversed when a child has a relationship with a supportive, responsive, and caring adult at an early age. Schools play a critical role in ensuring that behavioral problems are identified early, so that young people can grow and thrive in a healthy environment. Schools can lead coordination efforts in bringing youth-serving agencies together to guarantee that children, youth, and families can easily access services that are community-based, child-centered, family-focused, and culturally and linguistically competent. We often think of abuse being physical, sexual, or neglectful, but emotional abuse is also damaging and often difficult to spot. It is also frustrating because even when it is identified, child protective services are frequently focused on a child's imminent health and whether their lives are in immediate danger from abuse or neglect. While the damaging effects of emotional abuse have been established, it is not typically considered to be life-threatening and may not result in action by the local Department for Children's Services. Here are different types of trauma. Think about media violence and how it can include watching the news. Think about children who watch 9/11 live on TV or shootings on TV. Extensive viewing of television violence by children causes greater aggressiveness. Sometimes watching a single violent program can increase aggressiveness. Children who view shows in which violence is very realistic, frequently repeated, or unpunished are more likely to imitate what they see. Children with emotional, behavioral, learning, or impulse control problems may be more easily influenced by TV violence. The impact of TV violence may be immediately evident in the child's behavior, or it may surface years later. And young people can even be affected when the family atmosphere shows no tendency toward violence. While TV violence is not the only cause of aggressive or violent behavior, it is clearly a significant factor. This slide talks about the effects of trauma on the brain. The good news is that by stimulating children's brains, we are able to build synapses, and by teaching children skills and having them practice social skills, we can increase the chances that the neurons for appropriate social interaction are kept and not pruned off. By using them, they don't lose them. Since the brain functions on a use it or lose it basis, the parts of the brain that are most stimulated are the parts that are the most developed or strongest. Consequently, when ACEs are prevalent in our lives, those most primitive parts of our brain, the brainstem and limbic systems, grow stronger while our cortex and prefrontal cortex become underdeveloped. Radiologic studies show that brains exposed to a high number of ACEs are actually smaller than brains that have had fewer ACEs or none. There is also less activity in the higher brain structures as opposed to the limbic and brainstem regions. The good news is that the negative effects of ACEs can be minimized as resiliency is increased. This is true across the age spectrum. Resiliency is what helps us to bounce back when bad things happen and overcome the negative effects that ACEs can have. By working on building safe, nurturing relationships and learning to regulate emotions, we can help the brain to heal, opening the opportunity to live rich, successful, and fulfilling lives while minimizing the long-term negative effects of the adverse events in our lives. Why is resiliency important? The ability to recover from difficulties increases the likelihood that individuals will be able to reach their full potential and mitigates the damaging effects that adverse childhood experiences can have over the lifespan. Jody McVitie, MD, co-founder of Sound Discipline, identifies two things that influence how a child is able to bounce back when bad things happen. First, how they are able to make meaning of their life experiences, and secondly, the network of safe, connected adults they have in their lives. People do their best thinking and learning in the context of safe relationships. The following are some protective factors that increase resilience. 1. Parental resilience, increasing parents' ability to problem solve and build relationships with their child and others. 2. Nurturing and attachment, listening and responding to a child in a supportive way and discovering and paying attention to the child's physical and emotional needs. This is an area that needs to be focused on for children who for whatever reason did not bond as infants. These children learned that they could not rely on adults to meet their needs and tend to take the initiative to get their needs met in ways that are not developmentally appropriate. It just doesn't occur to them to ask an adult for something they need. These are the kids that are identified as having reactive attachment disorder. Other factors in resiliency include social connections, having family, friends, or neighbors who are supportive and willing to help or listen when needed. 4. Concrete supports, having the child's basic needs met, such as housing, food, clothing, and health care. 5. Knowledge of parenting and child development, increasing parents' knowledge of their child's development and appropriate expectations for their child's behavior. And lastly, social and emotional competence of children, helping the child to interact positively with others, manage emotions, and communicate feelings. This is an area where you can have a great impact on a child's resiliency. Parents, teachers, and behavior coaches can help children by gaining an understanding of ACEs, creating environments where children feel safe emotionally and physically, helping children identify feelings and manage emotions, creating protective factors at home, schools, and in communities. This is the definition of emotional disturbance that we follow for ED eligibility. These are the conditions that we look for. In the first condition listed here, we rule out cognitive reasons for why they are unable to learn. These kids have average or above average levels of intelligence. They do not have vision or hearing problems that are the primary reasons for why they are unable to succeed academically. The last two conditions listed on this slide means that we are looking for some form of depression or anxiety, which are referred to as internalizing features. These characteristics describe the outward or externalizing features that you may observe in some of these children. When considering immaturity, you may hear that a child just acts like a 2-year-old. That is one of the characteristics of these kids. They are developmentally delayed in terms of their coping skills and social skills. They have not learned through observation of what they can do to calm themselves in an age-appropriate way, if at all, or how to resolve conflicts with others, or how to get their needs met. They must be taught how to do this. These are the skills that you will be teaching them. ED kids don't know how to control themselves. They often do not like themselves or develop an identity as a bad child. It breaks my heart when I hear a child say that. Often, because they don't know how to get their peers' attention in appropriate ways, they are rejected by their peers. They overreact to situations that most kids their age are able to handle, and then they feel badly about it afterward. They would do things differently if they had the skills to do so, but they don't. It is important to remember that it is not intentional, because they did not have the skills to use in certain situations. We know that the hard days are going to happen. That is why you are with them. So have a plan for how to deal with them. On the good days, work on building your relationship with the child and creating some positive memories that you can draw on when a hard day happens. Maintain your rational detachment that you learned about in CPI training. Don't take it personal, so that you can remain calm. It's really not about you. The child just doesn't have the skills for handling the situation. Consistent doesn't mean inflexible. This is sometimes hard to get the feel for, but the best tip I can give you is to be consistent while balancing the child's dignity and having respect for them. If you can keep this in mind, it may help. You may hear some of these terms used about the students that you work with. Anxiety is a normal part of childhood, and every child goes through phases. A phase is temporary and usually harmless, but children who suffer from an anxiety disorder experience fear, nervousness, and shyness, and they start to avoid places and activities. A child who sees a scary movie and then has trouble falling asleep or has a similar temporary fear can be reassured and comforted. But that is not enough to help a child with an anxiety disorder get past his or her fear and anxiety. With treatment and support, a child can learn how to successfully manage the symptoms of an anxiety disorder and depression and live a normal childhood. We can facilitate a child's successful adjustment to a new challenge by being accepting of the child's concerns, listening to the child's perceptions, and gently correcting misinformation, and patiently encouraging a child to approach a feared situation one step at a time until it becomes familiar and manageable. Common childhood phobias include animals, storms, heights, water, blood, the dark, and medical procedures. Children will avoid situations or things that they fear, or endure them with anxious feelings, which can manifest as crying, tantrums, clinging, avoidance, headaches, and stomach aches. Unlike adults, they do not usually recognize that their fear is irrational. If a child has generalized anxiety disorder, or GAD, he or she will worry excessively about a variety of things, such as grades, family issues, relationships with peers, and performance in sports. Children with GAD tend to be very hard on themselves and strive for perfection. They may also seek constant approval or reassurance from others. Panic disorder is diagnosed if a child suffers at least 2 unexpected panic or anxiety attacks, which means they come on suddenly and for no reason, followed by at least 1 month of concern over having another attack, losing control, or going crazy. Obsessive-compulsive disorder, or OCD, is characterized by unwanted and intrusive thoughts, those are the obsessions, and feeling compelled to repeatedly perform rituals and routines, these are the compulsions, to try and ease anxiety. Most children with OCD are diagnosed around age 10, although the disorder can strike children as young as 2 or 3. Boys are more likely to develop OCD before puberty, while girls tend to develop it during adolescence. Children with post-traumatic stress disorder, PTSD, may have intense fear and anxiety, become emotionally numb, or easily irritable, or avoid places, people, or activities after experiencing or witnessing a traumatic or life-threatening event. Not every child who experiences or hears about a traumatic event will develop PTSD. It is normal to be fearful, sad, or apprehensive after such events, and many children will recover from these feelings in a short time. Children at most risk for PTSD include those who lack a strong support network. Helping create a strong support network for the child can help them to heal. Anxious children perform best in a calm, supportive, but organized classroom. Because change and uncertainty can be unsettling, a structured classroom, calmly disciplined, will let children feel safe and know what to expect. An ideal situation is a teacher who maintains authority positively, using reason and respect rather than fear for punishment. If there are this many people who are depressed, and we know that 80% of people who receive treatment get better, why don't they get help? Many times, children and youth cannot seek help on their own. They have to rely on the adults in their lives to get help for them. Even when they are old enough, they may be concerned about how other people will view them and treat them. People's attitudes and beliefs about mental illness set the stage for how they interact with and support a person with mental illness. When people have positive attitudes about mental health, they may engage in supportive and inclusive behaviors, such as a willingness to date a person with mental illness or to hire a person with mental illness. When activities and beliefs are expressed negatively, they may result in avoidance, exclusion from daily activities, and in the worst case, exploitation and discrimination. Attitudes and beliefs about mental illness are shaped by personal knowledge about mental illness and knowing and interacting with someone living with a mental illness. Attitudes and beliefs can be influenced by cultural stereotypes, media stories, and institutional practices. By becoming educated ourselves and by sharing information, we can have an impact on the attitudes and perceptions of those in our own circles. Even one person can make a difference. Depression is a treatable mental illness characterized by long periods of low or depressed mood that can occur at any stage of life. Recognizing the signs and symptoms of depression in teens and children can be challenging, though. It can be difficult to tell the difference between major depressive disorder symptoms and normal moody behavior, because children may not display the typical symptoms of depression in the same manner as adults. It may be present as something that looks very different than how we typically think depression is manifested. School staff are on the front lines of the battle against depression, and therefore have the potential to act as an essential part of a student support network. What does this mean for the busy behavior coach tasked with what may feel like mind reading? When symptoms like these crop up, it's important to take your own feelings of frustration out of it, to reach out to the student with an empathic tone, and to dig down deep in search of the right solutions. 40% of adolescents in the world do not have the opportunity to participate in secondary education, yet this is particularly a time in their lives when their brains are adaptable. Because adolescents' brains are going through these rapid changes, as educators we have a powerful, wonderful chance to influence adolescents' education and social development. During the teenage years, adolescents literally have the ability to pick and choose who and how they want to be when they are older. I really encourage you to click on the links in this slide for more in-depth and fascinating information about our brains and how the teenage brain works. If you watched the video by Jill Bolt-Taylor, you understand that while these major changes are a normal part of healthy brain development, it can often make teens feel unfamiliar with their own brains, lost and confused. This in turn can put the amygdala on high alert, and because the amygdala is directly related to feeling fear, significant changes like these can increase anxiety. They may not know what is happening, but there is a biological reason for it. Many researchers and educators believe these major shifts, as well as the hormone surge in the feeling of having a brain under construction, may be at the heart of why so many significant mental illnesses develop at this age, including depression. However, the link still needs further research before it can be confirmed. At the very least, taking the time to understand what is happening to the teenage brain and body will help us better separate normal from pathological developments to a student's personality and moods. Just as the causes of teen depression are complex and diverse, so too are the possible interventions. You can reach out to the student and help to create a support network for the child, which may include the classroom teacher or teachers, the special education teacher or teachers, the student's family, and the school counselor, as well as any outside help to intervene in the following ways. Please pause this and click on the link at the bottom for more information about each of these interventions. Depressed students become targets for bullies, so watch to make sure they aren't being victimized. Implement an anti-bullying program. Carol Gray has a curriculum for elementary students that teaches children protection skills, how to get bystanders to support the victim, and the difference between reporting an incident and tattling. Teaching mindfulness and strategies for managing stress go even deeper, as Jill Bolt-Taylor articulated so cogently in her TED Indianapolis speech in the link on the previous slide. Around the 3-minute mark, only students themselves have the power to break their own negative circular thinking and to free their brains from the grip of their amygdalas. Educators can help students break these cycles by helping them to understand depression, as well as how their brains work, and by encouraging them to pay attention to and examine their feelings. Some studies also indicate that teaching students how malleable their personalities and life situations can be as they develop can help prevent a rise in depression rates. Teachers can get started in teaching mindfulness simply by modeling it themselves and by making time for quiet and meditation before exams to combat anxiety. PBS has produced an extensive teacher's guide to teaching mindfulness that provides an excellent definition of mindfulness, explores the links between a lack of mindfulness and stress in the classroom, and teaches a number of techniques and activities for implementing mindfulness in the classroom. In children, manic episodes may present as an excessively silly or joyful mood that is unusual for the child, or an uncharacteristically irritable temperament, and are accompanied by unusual behavior changes, such as decreased need for sleep, risk-seeking behavior, and distractibility. Depressive episodes may present as a persistent sad mood, feelings of worthlessness or guilt, and loss of interest in previously enjoyable activities. Behavioral changes associated with depressive episodes may include fatigue or loss of energy, gaining or losing a significant amount of weight, complaining about pain, or suicidal thoughts or plans. A family history of bipolar disorder is the strongest risk factor for the condition, and the level of risk increases with the degree of kinship. Often, older adults in a family may not have been identified as having bipolar disorder, but there will be a history of self-medicating through drug or alcohol abuse or some other psychiatric diagnosis. For an example, a great relative may have been diagnosed as schizophrenic or melancholic in the past. The lifetime mortality rate from suicide for bipolar disorder is higher than some forms of cancer, which is why it is sometimes referred to as the cancer of mental illnesses. Using increasingly sophisticated neuroimaging technology, scientists have documented physical differences in the brain that are associated with bipolar disorder. While it was thought the disorder resulted from a chemical imbalance, researchers can now also identify specific areas of the brain that are affected by the illness. For more details on how it impacts the brain development, pause and click the link. School staff who understand the effect of bipolar disorder on the brain can better adapt to changes in the child's level of functioning. Classroom accommodations and modifications should be flexible so they can be adjusted to reflect current level of functioning. Teachers who make assignments within the child's present capabilities can reduce stresses that can trigger an episode of instability. Similarly, raising expectations in response to a child's increasing wellness can ensure that the child does not develop learned helplessness. For details on how it impacts the brain development, please click on the link. The euphoria of the manic state is what makes this disorder so deadly. Individuals may enjoy the mania so much that they resist being consistent with their medication. The everything else is just somewhere in between becomes dull and boring. They miss the feeling of being able to think faster, feel better, and quit taking their meds. When the cycle hits bottom, it feels so low that life seems too hopeless and painful to continue, and suicide is attempted. Far too many succeed. For details on how it impacts the brain development, please click on the link. These supports are helpful during times of stability as well as periods of instability, and they can be adjusted as appropriate to reflect the current level of functioning. All adults at school who interact with the student should be made aware of the child's illness and should understand the importance of maintaining a supportive, low emotional response and a low stress environment. It is not uncommon for children with bipolar disorder to feel overwhelmed by seemingly ordinary events and challenges. By providing designated safe adults to whom children can turn, and safe places where they can seek refuge in times of emotional crisis, schools can help to diffuse these crises. For more details on how it impacts the brain development, please click the link. Attention deficit hyperactivity disorder is defined by a persistent pattern of inattention, for example, difficulty keeping focus, and/or hyperactivity impulsivity, for example, difficulty controlling behavior, excessive and inappropriate motor activity. Children with ADHD have difficulty performing well in school, interacting with other children, and following through on tasks. Adults with ADHD are often extremely distractible and have significant difficulties with organization. The more classic presentation may include some of the following: trouble paying attention, inattention to details, and make careless mistakes, easily distracted, loses school supplies, forgets to turn in homework, trouble finishing classwork and homework, trouble listening, trouble following multiple adult commands, blurting out answers, being impatient, fidgeting or squirming, leaves seat and runs about or climbs excessively, seems on the go, talks too much and has difficulty playing quietly, interrupts or intrudes on others. Any child may show inattention, distractibility, impulsivity, or hyperactivity at times, but the child with ADHD shows these symptoms and behaviors more frequently and severely than other children of the same age or developmental level. ADHD must begin before the age of 7, and it can continue into adulthood. A child presenting with ADHD symptoms must have a comprehensive evaluation. A child with ADHD may have other psychiatric disorders, such as conduct disorder, anxiety disorder, depressive disorder, or manic depressive disorder. Research clearly demonstrates that medication can be helpful. Stimulation medication can improve attention, focus, goal-directed behavior, and organizational skills. Other medications such as guanfacine, clonidine, and some antidepressants may also be helpful. ADHD runs in families with about 25% of biological parents also having this medical condition. Current research suggests that ADHD has a high degree of heritability. However, the exact gene or constellation of genes that give rise to the disorder are not known. Environmental risk factors may include low birth weight, smoking, and alcohol use during pregnancy, exposure to lead, and history of child maltreatment. Here are some strategies that can be helpful. Other treatment approaches may include cognitive behavioral therapy and social skills training, parent education, and modification to the child's education program. Behavioral therapy can help a child control aggression, modulate social behavior, and to be more productive. Cognitive therapy can help a child build self-esteem, reduce negative thoughts, and improve problem-solving skills. Parents can learn management skills such as issuing instructions one step at a time, rather than issuing multiple requests at once. Education modifications can address ADHD symptoms along with any coexisting learning disabilities. A child who is diagnosed with ADHD and treated appropriately can have a productive and successful life. If a child shows symptoms and behaviors like those of ADHD, parents may ask their pediatrician or family physician to refer them to a child and adolescent psychiatrist who can diagnose and treat this medical condition. Schizophrenia is a brain disorder that impacts the way a person thinks, often described as a thought disorder, and is characterized by a range of cognitive, behavioral, and emotional experiences that can include delusions, hallucinations, disorganized thinking, and grossly disorganized or abnormal motor behavior. These symptoms are chronic and severe, significantly impairing occupational and social functioning. While family history of psychosis is often not predictive of schizophrenia, genetic predisposition correlates to risk for developing the disease. Physiological factors such as certain pregnancy and birth complications, and environmental factors such as the season of birth in either late winter or early spring, and growing up in an urban environment may be associated with increased risk for schizophrenia. People with schizophrenia can experience what are termed positive or negative symptoms. Positive symptoms are psychotic behaviors including delusions of false and persistent beliefs that are not part of the individual's culture. For example, people with schizophrenia may believe that their thoughts are being broadcast on the radio. Hallucinations that include hearing, seeing, smelling, or feeling things that others cannot. Most commonly, people with the disorder hear voices that talk to them or order them to do things. Disorganized speech that involves difficulty organizing thoughts, thought blocking, and making up nonsensical words. Grossly disorganized or catatonic behavior. Negative symptoms may include flat affect, disillusionment with daily life, isolating behavior, lack of motivation, and infrequent speaking, even when forced to interact. One in 4 of us are touched in some way by mental illness. The earlier the diagnosis and treatment, the better the outcome. We hope that what you have learned today will help you in your work with kids, and that you come to the meeting with lots of ideas to discuss with each other.